Well, we'll let everyone get settled in. We're just admitting a few more students and then we'll get started for today. All right, and Lisa, should we go ahead and get started?
Yep, I think we're good. Hello, everybody. I'm Lisa Orlando. I'm a career advisor for the health and science students at Grand Valley State University. Welcome to the Healthcare Experience panel today. I have a few slides to go over before we start the Q&A with our guest panelists today. So if you've had an opportunity, please do so now and check in using that QR code that is on the screen for all of you. So we're just going to go over some Zoom meeting norms. This has been part of our life now for a while, but just in case, keep your video turned on, please. Your sound muted. If you have any questions or comments, please add them in the chat. We will be addressing those at the end of the panel today. Meeting etiquette is the maintaining that direct eye contact, speak clearly, and say your name. Any negative behavior, all attendees must comply with the Zoom acceptable use policy. So just being aware of that. And once again, on behalf of the Grand Valley State University Career Center, we welcome all of you to this evening's event. We do have some Career Center resources that, given this platform, we wanted to share in case this is the first time you're hearing about these opportunities. But you are welcome to join the drop-in lab at the Career Center, both at Allendale and the Pew campus, Mondays through Fridays, 11 to 4, where we provide resume reviews, mock interviews, career-related questions, and that's a great opportunity to get assistance with scheduling one-on-one appointments with your particular program advisor. We have a virtual career lab that provides an opportunity for you to get your resume reviewed after hours, so 4 till 7 p.m. Monday through Thursday. And you would simply sign into the GVSU Career Center, and it's through Blackboard. So using your GVSU credentials, you sign into that, and you will get connected to that virtual career lab space. We also have Handshake, which is how you attended this event today. Great place to check out new job postings that are updated daily and create job filters, notifications, research, and follow certain employers. And we also have something new this year is joining a career community, which is a great opportunity for all students at GVSU and alumni to streamline program specific information. And you can opt into one or more communities. That's personal choice so that you're not over inundated with email. And you will receive a monthly newsletter and get actual current job information and be able to connect peer-to-peer. So please look into joining a career community. And I will also include that at the end of, in the chat at the end for all of you, the direct link for that. So with that, we'd like to welcome today's panelists. We have Ascension Health here today, Fresenius Medical Care, Helix Scribe Solutions. Unfortunately, the representative from Pine Rest, Molly, is not available, but she did provide me her contact information. So I will be adding that to the chat if you are interested in learning more about Pine Rest. Dan Combs may be here from Spectrum Health. If not, I also have his contact information available, and Sunset Senior Communities. So with that, we'll go ahead, Megan, and let you get started.
All right, thank you very much, Lisa. And students, thanks for joining us today. We did want to let you know it's okay if your cameras are muted right now or your video is off, and we have muted all participants just so we can avoid any interruptions for the panelists today. Panelists, we're just going to jump right in and get started. And my name is Megan Veltri. I am one of the health science advisors at the Career Center, and Lisa Orlando is also with me as well. And then students, just so you know, we do have some academic advising representatives here too. So if you do have some questions at the end, we can also help to answer some of those. But right now we're going to focus on our panelists today. So what I'll do is, panelists, we'll just start with introducing yourself and your role, and then you can let us know what organization that you're with. So I'll just go ahead and call your name since I know it's kind of hard via Zoom. So Sharon, if you'd like to start.
Yeah, so go ahead and introduce myself and answer the rest of the questions as well that we had.
No, just go ahead and introduce yourself, your role, and then the organization that you're
okay.
in. And you know what, to make it simple, if you wanted to talk about what types of positions you're recruiting for, that'd be great too.
Okay. My name is Sharon White. I'm one of the talent advisors from Ascension Borges. I've been with Ascension for a little over 18 years. I started out cleaning rooms and transporting patients up on the labor and delivery floor. Right now I recruit for RNs, patient care techs, CNAs, unit secretaries, that type of thing. But I've recruited for a wide range of positions, including food nutrition, environmental services, where I started out, transport, a wide range of clinical as well as non-clinical positions.
Thank you, Sharon. Maria, would you like to go next?
Sure. Hi, everyone. I'm Maria Marifosque. I'm also a talent advisor, similar to Sharon. Sharon and I actually have been working forever. We work in the same office, and we moved now to all remote. But I've been with Ascension for the past 14 years. Typically, I handle all of allied health, your OT, PT, speech. I have a bulk of nursing positions as well, same as Sharon, and a few stragglers like health screeners, unit secretary, you name it, like we've done that. I was just looking, and I think I hired 50 people in the past month, which is like pretty, like it's like high, because usually we only have like about 20 per recruiter, but it's been really like busy.
Maria, I don't think we want to know how old half these students were when we started at Borges.
Yeah,
and for the long game here.
Yep. I was talking to one of my screening, and I told them I started in HR in 1996. There's your. And I used to recruit for engineering for Grand Valley as well, a million years ago.
Well, we're happy to have you here with us, Maria. Thank you for coming back.
Thank you.
All right, and Renee, would you like to go next?
Sure. So hi, I'm Renee Holloway. I am with Sunset Senior Communities. I am the recruiter for Sunset. We have 3 campuses in Jenison, so we're kind of located pretty close to Grand Valley. And I did graduate from Grand Valley in 2018. I've been at Sunset since I was actually in college. I started as a server and worked my way into the office when I graduated. So we definitely kind of focus on those kinds of growth patterns with our students. So we really encourage people who have never had healthcare experience to come work for us. We have a lot of entry-level resident aid positions, direct care, housekeeping, food service, that kind of stuff that all revolves around patient care, in hopes to, encourage people to get patient contact hours. And I know that's a big help for nursing students. So that's kind of where our positions are focused at this time.
Excellent. Thanks, Renee. So nice to hear an alum and someone who was able to move up within the company. Thank you.
Yeah.
Rebecca, would you like to go next?
Sure, thanks, Megan. So my name is Rebecca. I am an RN and I do clinical education with Fresenius Medical Care. We are looking to recruit nurses. We also have PCT positions or patient care technician positions. And we are located all over the United States. So pick a city, we're probably there. Did I answer all your questions?
Yeah, that's great. Thank you. Sorry, I was just trying to get off mute. And Jeff, thanks for coming again. Would you mind going ahead?
Yeah, well, thank you for the opportunity. Of course. Jeff Turco, I'm the program director for the GVSU Scribe Academy. On the title slide we just saw, you probably saw Helix Scribe Solutions. That's our clinical partner who all students going through the Scribe Academy, when you graduate, become part-time employees as medical scribes with Helix. So they will put scribes at locations where they have partners, including Spectrum Health and emergency departments, as well as specialty offices, pain management, orthopedics, primary care, and others.
All right, thanks, Jeff. And so a big question that students usually have is, how would I get involved with your organization? So how would I start to get connected? If you wanted to talk about that. And a big concern for our students is schedules. Their schedules change every semester. They might be on a Monday, Wednesday, Friday block or a Tuesday, Thursday block. Can you talk about if you work around schedules and then how students can start to apply to your positions or get connected with your organizations? And Sharon, if you want to go ahead and start, that'd be great.
Yeah. So how to connect with our organization is on our website, ascension.org. You'll find several different ways that you can get connected there. One of them being the careers site, and another one would be volunteering. So we have volunteer opportunities as well. As far as school schedules, it kind of depends on the unit as well as the position. So like my PCTs, my patient care tech positions are 12-hour shifts. So if you're part-time, that's only 2 days a week. That's much easier to work around a school schedule at 2 days a week than it is, 5 8-hour shifts or something like that. It also kind of depends on that department and how many students they already have. If the last 4 people they hired were students and couldn't work Tuesdays and Thursdays, man, we really need somebody to work Tuesdays and Thursdays as well. So we try to be as accommodating as we can. We've all been there. We've all been working students before. But yeah, those are the types of positions that I would recommend would be like part-time or PRN, meaning on call or as needed. Those are a little more flexible as far as school availability.
And Sharon, sorry, I should ask too, is there any specific training or certifications that the students would need to obtain before applying, or would they receive that training while they're on the job?
For those patient care techs, they would receive the training beforehand. CNA is preferred but not required. BLS is required, but within 90 days of start date, and we happen to have a BLS class here every 90 days. So you would be all set. Now, the only thing with those patient care tech positions is they do require 1 week of orientation of Monday through Friday, 8 a.m. to 4:30. So because we don't require a certification or anything like that, we do have to make sure that you're trained in those types of things, and you need to learn our codes, our charts. You need to learn how to be a PCT here. So it is Monday through Friday, 8 a.m. to 4:30. So I tend to hire most of my students for PCTs during Christmas breaks, spring breaks, summer breaks, that type of thing. Unless maybe there's some flexibility, they could miss this class or make it up somewhere else, something like that. But other positions, like I started out in environmental services, they don't require as much orientation as a patient care tech would. Transport, I also did that as well. That's a really great opportunity to, I knew the hospital like the back of my hand because I transported patients everywhere, and I got to meet with a wide range of healthcare providers. Those don't require as much orientation either.
Excellent. And students, we should encourage you, really any position that you can get in healthcare would be beneficial. Of course, if you're looking to work in direct patient care, that would be a great place to get experience and try it out and see if you like it before you fully commit to your academic program. But also, if the foot in the door is working in environmental services, that's great. You're still learning about the healthcare environment.
Food, nutrition, we even have laundry services here. We're like a little city of our own. When I started here, there were positions here that I didn't even know existed until I started working. So yeah, any way to get your foot in the door is a really great experience.
Thank you, Sharon. Maria, would you have anything to add to that?
Yes, and as with COVID and everything, we've added the health screener roles. So a lot of students that are in healthcare or going through healthcare, they snap those positions up. We've hired so many of them in the past year or so. I was just talking to Sharon that some of them actually let go of their position because they went back to school. So depending, because some of them are not going to school here in Kalamazoo, they went back to U of M, in Detroit or up north or wherever they are. So now we're backfilling a lot of the students that took all of our summer positions. But yeah, so health screener, it's a pretty great role. You're basically just saying hi to everyone, high school diploma, and that's it. They have flexible schedules depending on where you're going to be. So if you want to have only 2 days a week, that's fine. Or if you want to work only weekends, that's fine as well. So it's a good entry because you know everybody, because you get to greet everyone, all the stuff coming in at work.
Yeah, you make a good point there. I thought you would get to know everyone, which would be really important when establishing connections. Thanks, Maria. Renee, would you like to tell us about Sunset?
Yeah, thanks. So we do try our best to work around student schedules. We are very familiar with that. We have a lot of students that work for us. And we are very familiar with the ever-changing next semester. I have an opposite schedule. So typically right before the semester ends, managers will reach out and ask all of our students, hey, what's your schedule look like next semester? How can we work around that? We're pretty flexible with that. In terms of our current positions that we have open, we do have quite a few resident aid, which would be our like entry level care positions that would be shorter 4-hour shifts, which we feel is really helpful for students, just because I know committing to an 8-hour shift can be a little bit daunting if you don't have a full day off from school, especially if that's the only time you could do that would be on the weekend. That kind of takes up your whole weekend. So we do have some evening shifts available that would be 4-hour shifts, even some morning shifts. And we're definitely willing to work around whatever students have to make something work.
Is any training required?
No, we do not require a CNA license. We do have training opportunities to be trained to be a med tech eventually, which would obviously be something that we would do in-house, as it's not like an actual certification, but all of that happens in-house. The training program for all of our positions does not require any set, like, you have to be in training for 2 weeks or anything like that. We kind of base it off of how each person is learning as it goes, and our training our training schedules are pretty flexible as well.
That's excellent. Thank you.
Yeah.
Right, Rebecca?
Yeah, so just to clarify, Fresenius, because I know we're kind of a company that no one's heard of, we're a dialysis company. So generally hours wise, it's going to look anywhere from 4:30 a.m. in the morning to 9:30 at night, depending on the clinic. We're never open on Sundays unless we have a holiday that we're moving patients to a Sunday for. So you never have to work Christmas or Thanksgiving, which is awesome. And we're not open, for night shift hours, which is also nice. We give you a 12-week training program. You don't have to pay for it. That's something that we provide. And it is full-time. So if you were to come in to take like a PCT or patient care technician role, you would want to kind of apply in the spring to hopefully get hired in through the summer if that's when you're taking or not taking classes. We have clinics in Muskegon, Holland, Zealand, all throughout Grand Rapids that all have patient care technician roles available. We also provide tuition reimbursement as you're going through school. So that is another opportunity for you. And then I know you guys are pre-nursing program, but once you get into the nursing program, if you're looking to find a job before you're out of the nursing program, we also have a pre-licensed nurse program where we can offer positions before you're out of nursing school, and then you can actually get hired before you take your NCLEX. So that's another opportunity with us down the road.
Yeah, I think Fresenius has some great opportunities. It's a little bit more unique too. And so for students, it would be something a little bit different for your application, and you'd be able to speak to that in your interview. Awesome. Thank you, Rebecca.
Yep.
Yeah. And Jeff, would you like to go next?
Yeah, great. No, there's awesome opportunities here on this panel. So yeah, this is great. So the Scribe Academy, our website is pretty easy. It's gvsu.edu/scribe. And that's how you would apply online. Our training program, the theory training is asynchronous in Blackboard. So it's one that we can do over winter break or other times. And the clinical training would be around your schedule as well. The immersion departments are very flexible at Spectrum Health. They have scribe shifts from 6 a.m. going until 2 a.m. Monday through Sunday, 7 days a week. So a lot of flexibility there. Our medical specialty offices, those are a little more particular. They're like banker's hours, Monday through Friday, 8 to 5. And Helix really needs scribe people who are able to work those full day shifts, 8 to 5, at least twice a week. So it's a little tougher for your full-time student, great for gap year students and other maybe seniors who have a lighter course load. So something to consider for sure.
And Jeff, one thing that would be nice too is if you're working at Spectrum, you could potentially be on the bus route if you didn't have transportation, correct?
That's true. That's true. Yep, we have 3 ED locations that we're at: Butterworth Hospital, Helen DeVos, which are next to each other, and then there's Blodgett Hospital in East Grand Rapids.
And Jeff, scribe hours would count for pre-PA?
It really depends on the program. You know, Grand Valley's PA program does accept scribe hours as patient contact hours. Regardless, I think you can count them as healthcare experience. But depending on the program you want to apply to for PA, depends on how they categorize those hours. So it's something to research and look into.
Sorry, I didn't mean to add any confusion to that. I more so meant for students, just make sure that you're checking with your PA program, but Green Valley's program is good to go with scribe hours. Thank you. All right. So thanks for sharing all the different opportunities. Okay, 1 minute. Sorry about that. We have a little one home. Thank you for explaining those opportunities to us. Would you mind going over and talking about what unique things you think that your organization has to offer or that students might find intriguing or interesting? And we'll just kind of keep going in the same order, but Sharon, if you'd like to go next.
Yeah, one of the unique things about Ascension Borges is we kind of have umbrellas. So there's Ascension, there's the bigger national company of Ascension. So we have really great opportunities. There are ministries. We call ourselves a ministry because we're still very connected to our Catholic roots, and we feel that we're doing the work of Christ here. So we call ourselves ministries. We have ministries in Florida. We have ministries in Kentucky and Missouri, Wisconsin. So if you were to get a job here at one of the Ascension facilities and transfer to one of those other facilities, you're considered an internal candidate. Your benefits come with you, your seniority comes with you, it transfers with you to these new facilities, but also within Borges, the same thing happens. So we have ministries as far north as Plainwell, as far south as Dowagiac, as far west as Allegan, and as far east as Battle Creek. So you could work for any of those facilities, again, be considered an internal candidate, transfer to any of them and have no lapse in your benefits, have your seniority stay with you as far as, you know, retirement and that type of thing. So there's some benefits to being a member of Ascension, but also Borges itself. But for me, you know, working here for 18 years, there's just something extra special about working here. I think it's our mission, our vision, our values, that we are so connected to our community. Yeah. How do you feel, Maria?
Sorry, I'm trying to find the mute button. But yeah, piggybacking to Sharon, actually a funny thing happened. We have a physical therapist that doesn't want snow. So he actually is working for us, but also takes a PRN role in our Florida location. So whenever snow comes, he's like jutting off to Florida and works there as a PT internally, and then comes back here because he said it's not him, it's his wife who doesn't want snow. So which is unique, you know, like you've never seen anybody like doing two dual roles, but you can do concurrent roles in Ascension. And then we have candidates also that are in Texas or wherever they are, and then they transfer because of family, they're coming to us. It's still the same, like what Sharon was stating. So I feel that that's unique with us. And then one thing too that when we do all of these meetings, a lot of people don't understand, because Ascension is a Catholic ministry. We have a huge amount in terms of charity care. So we even in the news, that's what we always joke about, that we don't see any of it, but we actually do quite a bit in terms of our charity work. So if you go to the ER, if you volunteer there, you see people getting just dropped off in the car. You don't see it in the news, but we take care of them. We treat them, and at no cost to them. So I think it was like 3 billion, right? Something 3 million or something like that per year in terms of care.
Yeah, and just kind of the same thing with Maria. I hired an intern who was going to Western, but grew up in Detroit. And so after she graduated with her nursing degree, she's like, man, I really want to move back home. I was able to put her in contact with a recruiter over in Detroit. So there's some resources to being a national ministry, but also that state ministry as well. So some resources that we have behind us.
Sharon, just curious, and Maria too, would a student be able to maybe work during the school year in somewhere local and then be able to transfer in the summer to a different spot if they're going home for the summer?
They can, if they do a concurrent role. It really depends, because an RN, it's a little bit technicality because, you know, with the RN role, it depends on their unit and how they rotate. But yeah, some roles do.
Okay, thank you for clarifying that. And Renee?
Yeah, so we offer, I think, quite a few benefits for our students. The one that I would like to highlight is our nursing tuition reimbursement. So we do provide tuition reimbursement for our students after they've been with us for 6 months. So they can apply for that every semester. And typically we do award up to $250 a credit hour, which is quite a lot. I know that it depends on how many hours per week you're working, but I do think that's a pretty big benefit for our students. I think the other thing that makes us a little bit unique is we do have a lot of people who have had stories, I think similar to mine, how we started at Grand Valley, kind of worked our way through college and finished. A lot of our nursing leadership ended up doing something similar. They have stories of them starting in direct care, getting their nursing license and working as a nurse and then a supervisor. So we have a lot of pipelines to growth that you can kind of see in our leadership staff even. I do think that our flexibility is important too. I know that some of the facilities that are similar to ours, maybe not the people that are on this call, but specifically nursing homes and assisted living homes tend to not offer shorter shifts, which I think is something that makes us a little bit unique, just in that we know how important it is to balance school and work.
Yes, thank you for sharing that, Renee. And so glad to hear that there's so many alumni that are working at Sunset and then, you know, kind of staying on after. I think that shows a great work environment. Thank you.
Yeah.
Rebecca.
Yeah, like you said, I think dialysis is a really unique field in general within healthcare. So for those of you who maybe aren't familiar with dialysis, essentially it's for patients who no longer have kidney function. So it's a health-saving treatment. What I think is awesome about dialysis is it's one of the few places outside of a nursing home where you can still really build a relationship with your patients. Patients come in generally 3 times a week. The typical dialysis treatment is about 4 hours, and they're going to continue to come to you until either they get a kidney transplant or they pass away because they need this life-saving treatment. Also, I thought it was really cool. We just got ranked number 42 out of the most loved workplaces by Newsweek for 2021. And that's for employee happiness and satisfaction at work. I would say, you know, dialysis is a passion. People either love it or they don't, and that's okay. But yeah, I've been here for 7 years now. I've been a nurse for 9. And it's just a good company to work for. Again, a lot of growth opportunities within this company as well. I started as a floor nurse. I've done management with the company, and now I'm doing clinical education. And actually I'm about to change roles and I'm going to do home therapies dialysis. So that's another opportunity down the road if that was something you're interested. There's a big push towards home dialysis as well. So a lot of opportunities, and we're also actually a global company. We're based out of Germany. So lots of options as far as where you're able to work. We have someone who just transferred down to Florida because they wanted to move to Florida, and we called up the, you know, nearest Fresenius and we're like, hey, do you have any positions open? And he transferred down there, no problem. So a lot of different opportunities within the company.
All of us seem to have Florida on our mind.
I was
right
gonna
now.
say.
I know. Right?
Florida's sounding really nice right now as we're about to get some more snow. So excellent. Thank you, Rebecca. And Jeff.
Yes, thank you. So yeah, there are a lot of great opportunities mentioned. A lot of them are patient contact kind of positions, which is great. The medical scribe role, if you don't know, is a little different in that you're supporting the providers with their documentation. So every time you come in for a shift, you're really with the provider shadowing them with the laptop. So every encounter they have with the patients, you're really taking their notes. It's different from, taking notes for your roommates on phone calls, right? It's a lot more technical than that. A lot of medical terminology, all the things needed for appropriate billing and reimbursement for quality care for the patient. As a scribe, you're a member of the team, highly appreciated. It's a really great exposure and experience, especially if you want to go into PA school or be a doctor or any other kind of profession. As I tell a lot of our applicants, it's great if you have prior healthcare experience or not, but getting diverse experiences is just helpful, for any kind of graduate application that you go into. I hope that scribing is considered on one of those items to consider going forward.
Yeah, Jeff, I think from the students that we've had who've scribed in the past, something that they've enjoyed is, they've gotten to work with a healthcare professional pretty closely. They've seen a lot of different healthcare professionals. I would say too, there's an opportunity to work at Helen DeVos, and a lot of students are interested in working with children. And so you would be in that environment. So we've heard great things about the Scribe Academy.
Yeah, no, thank you very much so.
So I think the next thing we'd like to transition to is, how would a student go about getting involved? I think we've touched on this a little bit, but if there's anything that you all would like to emphasize, or is it okay if students reach out to you directly?
Students can reach out to me directly. I can put my contact information out there. Our website, ascension.org. And then also to keep in mind those other positions that I talked about: environmental services, food nutrition, transport is done through a company called Touchpoint, and I'll include their website as well. Our scribing is done through Scribe America, so I'll include that. And then our front desk, like when somebody comes into the ER admitting, that type of thing is done through a company called R1, and I can include their website as well.
Thank you, Sharon. Maria, anything to add with that?
Yeah, they are more than welcome to reach out to us. Actually, in Ascension, we highlight the talent advisors internally as well. So we help our internal try to figure out their careers, because some of them just straight out of high school, they work for us and have no idea where to go. So we help them because we have like a lot of, as mentioned, the tuition reimbursement. We have the PCA to nursing role as well. That's free for our associates. So if they are interested and then they get in, and then later on, they're trying to still figure out, okay, maybe nursing is not good for me, or maybe PT is that it, or, there's an internal mobility for talent at Ascension as well.
Excellent. Thank you, Maria. Renee?
Yeah, so I think our website was dropped in the chat, but it is jobs.sunsetcommunities.org. All of our jobs are listed right there. If there's something that someone is thinking about doing or has questions about and they aren't quite seeing what they're looking for, there is a button at the bottom that says, "Don't see what you're looking for," and you can put in your resume, and that goes straight to me. And then we can kind of figure something out if there's not something that is directly available when you're looking. I'm also open to people reaching out to me directly. I am the main recruiter for Sunset. Feel free to connect with me via email, or LinkedIn is fine as well.
Thank you, Renee. Rebecca?
Thanks. So yeah, if you look up Fresenius Medical Care job openings, that's an easy way to put in an application with us. I'm sorry, what were your other questions?
Okay. Just if it was okay if they reached out to you directly, or if there's someone else in the organization they should be connected.
Yeah. So Josh Russo is going to be our recruiter that you'll contact. And we do have opportunities if you're interested in just doing like a job shadow. That is definitely something that Josh can help set up. And we can generally just set that up with any clinic that's near you.
Yeah, the job shadowing is great. And we actually, I have that as an additional follow-up question to ask. But Rebecca, as far as the job shadowing, do the students have to do any additional commitments, or is it just a one-time event and that's okay?
Yeah,
and speak a bit more about that.
Yeah, if you're just interested in learning more about dialysis, because I know dialysis is, again, such a unique field, there's really no commitment that you have to make or anything like that. And I think it's a good way to just kind of get a feel for what it's like, because it's definitely a unique field. As a PCT, you would actually be putting the patients on, getting their vital signs, all that stuff. So it is a lot. And it's a great foot in the door in healthcare in general.
Yeah, and I think seeing dialysis for any student that's interested in healthcare would be beneficial. Thank you. All right. And Jeff?
Yeah, so feel free to reach out to me anytime. I think Lisa also dropped my website on the chat, but it's gvsu.edu/scribe. And I think my information is all over that. But also, if you'd like to speak with the Helix Scribe, I can get you in touch with them as well and hear from their perspective of how they like the role and how it's helped them and that kind of thing. A lot of resources on our website as well, links to Grand Valley's programs, as well as frequently asked questions from scribes and applicants and how it can help you with your career going forward.
Thank you. All right, so Lisa, we've asked most of our questions, and I thought we'd leave it open for time for questions from students.
Excellent. I also want to include and just give another shout out for Molly at Pine Rest, who is not able to be with us today. Please feel free, if you have any questions about Pine Rest, she said to email her directly. I did include her information in the chat. So feel free to reach out to her, and Dan Combs from Spectrum Health as well, if you have questions about opportunities there. So we did open up the Q&A. If you have any questions at this time, please use the chat. That would be very helpful. And one question that did come in for our panelists is any idea on the starting pay, the salary range for positions that are available, or are these volunteer? What does that look like in all your different locations? We could start with Sharon.
It depends on the position, but if we're talking for students, mostly it would be around what we call the socially just wage of $15 an hour. You know, there are some differences depending on the position. We also have something called socially just benefits. So one of the things that we believe is healthcare that leaves no one behind. And unfortunately in this country, if you don't have health insurance, sometimes you're left behind. So we do offer benefits at part-time or above. So fully benefited positions, part-time or above, socially just benefit, socially just wages. And we're really trying to, you know, be on the edge of those wages and those benefits and that type of thing.
Thank you, Sharon. Renee?
Yeah, so our non-clinical roles, food service, housekeeping, that kind of stuff would typically be around $13 an hour. Our clinical roles start at 14, but as soon as you're on a second shift position, that would bump up to 15 as well. So most of our students are on second shift just because that works better. So I would say that 15 with no experience, that is pretty much our base wage.
Thanks, Renee.
Be
Rebecca?
careful because it does go based on position as well, but yeah, generally around 15.
Right. Rebecca?
So as far as wage goes, I honestly can't really speak to that. I haven't gotten any permission to do so, but I would say we would be competitive with what other people are putting out there.
Thank you. And Jeff?
Yeah, so this is one area where others may have an advantage on us. So our specialty scribes that work in the medical office are $12 an hour. And then the ED scribes are on minimum wage. And one reason why, I mean, I'm not paying people directly, it's through Helix. But the idea is that also that a lot of students are getting job shadowing and doing volunteer work. And this is sort of very similar to that, but you get paid on top of that. So that's sort of the background behind that, the value of the experience. Of course, you can get valuable experiences other places as well. And I just want to leave you on that note as well.
Thank you. Lisa, it looks like we had another question.
We do. We have one more question. This is for Rebecca specifically. In regards to flexibility with students transferring between working at one location close to home during the summer and another one during the school year.
Yeah, so, that's going to just depend on the hiring managers, if that's something that they're willing to work out. All of our managers are in close contact with each other. So if both managers in both locations could find benefit from that, then they might agree to it. Also, we do have float positions within the company that might be something you could look into, which is, but that would be kind of where you would go to multiple different locations throughout the year. I don't know if that would be something that would work for you. But it would be something just to, once you got your application in and maybe had a phone interview, mention that in the phone interview, that that's something that you would be interested in. I do know of one person who was in school and they did this for that particular individual, but it's not something that's super common.
Great, thank you so much for responding to that. And a question that didn't come in, but one that I'm very curious about and always ask the panelists at this point is in regards to the vaccine. Is it mandated? Are exemptions allowed at your locations? If you could just quick yes or no to those, and we'll start round robin with Sharon.
Yes, mandated. Yes, exemptions for religious or medical reasons that do have to be approved through a board.
So ours is not mandated. We do require weekly testing if people are not vaccinated, but not mandated at this time.
Rebecca?
Ours is mandated, but we allow medical exemption or religious exemptions as well.
And Jeff?
Yeah, I would say the same for Helix. One thing I like to mention though, if you do have the exemption from Grand Valley, doesn't mean it's transferable to other institutions. So it's something to be careful of. It's going to be based on that institution, their policies. And so something that's why Helix, with the different groups they work with, they are trying to make it so it's mandatory, but of course always the religious exceptions that apply.
Thank you all for that response. I appreciate it. And I'm not seeing any other questions, but we'll give our audience a moment. If you have any, now is a great time to put them in the chat there.
And maybe I'll just plug the Career Center a little bit and how we can help you students. So when you are applying to these positions, it's great to put your best foot forward, and we would like to help you with that. So Lisa had mentioned earlier that you can come to our office. You can use our resources on our website. So we have resources for resume writing and interviewing. So hopefully when you submit those applications, it will lead to a job opportunity, but we want to make sure that you have your materials in order. So you can utilize Career Lab too. So those are our drop-in hours. You do not need an appointment. You'll see the information for that on our website. You could schedule an appointment with an advisor for a simulated interview. We also have a resource called Big Interview, which will help prep for that. We have our Work Like a Laker podcast. So you could also check that out. You can listen to that on demand anywhere where you listen to podcasts. And there's some great information there on resume writing, interviewing, kind of anything that's getting you ready for the job search process as well. If you have questions about how to, if you're wondering, well, how would I ask an employer, something during the interview, that's also something that we could help coach you on too.
Megan, can I ask a question?
Yeah, absolutely.
None in the chat, but I was wondering if any of the organizations can speak to any volunteer opportunities that might be available.
Yeah, sure. Let's go ahead and ask. Sharon, go ahead.
Yeah, so during COVID, we did reduce the amount of volunteers, but we have since opened up our volunteering again. And there's a wide range. I mean, we have to be careful. There can't be like direct patient care in a volunteer opportunity, but there can be direct patient contact in a volunteer opportunity. Goodness, Maria, the gift shop has volunteers delivering flowers, that type of thing. So yeah, we do have a wide range of volunteering opportunities available. It just is not going to be direct patient care necessarily.
Thank you, Renee.
Yeah, so we have some volunteering opportunities available, mostly in the wellness type of role. So basically, a lot of our events that are held by the wellness department. So anything from, you know, having a craft fair to a picnic to an outing, you know, they always need extra help. So that's typically what our volunteers help with. We do also have like a Meals on Wheels type program that helps out the Jenison community that we run out of our kitchen using like the extra food. So that is something that we have volunteers for as well. The volunteer application is similar to our regular job application. So you would just go on our website and then you would just, we would find something that would essentially work with your schedule in whatever way we can.
Excellent. Thank you, Renee. Rebecca?
So I was not aware of any volunteer opportunities within our company. I'm closer to more direct patient care, but I just reached out to our recruiter via our teams. And I said, do we have any that I wasn't aware of? And he said that there may be some. So if you are interested, I would just reach out to Josh Russo. His contact information is in the chat.
Thanks, Rebecca. I think, you know, the volunteering or job shadowing opportunities, those are helpful for students when they're not sure how much they're able to commit. So thank you.
Yeah.
And then Jeff?
No, we do not offer any in particular, but I do look favorably upon students that do have volunteer experience because it shows that you have that initiative and you also have that experience. You know kind of what experiences that you want to get. You see some of the roles of what people do. So I definitely encourage you to pursue whatever you can.
Very good point. Sometimes that volunteering can help lead to other things. Lisa, go ahead.
I would say just as an example on a recruiter end, I've literally had a hiring manager come to me and be like, look for so-and-so's application. They're a volunteer. They're always up on my unit doing this and that. They're really great. Their customer service is perfect. So you're literally face-to-face with those managers, and I hire volunteers from our facility all the time.
It's good to hear, Sharon. Thank you.
And we do have a question for Sharon. Does Ascension have a genetic counseling branch or a partner?
Not that I'm aware of, Maria, are you?
Yes, so we do. It's actually done through whatever whatever unit you're interested in. So our cancer center have a partner for genetic counseling. Some, if it's out of network, for example, the one that I'm familiar with is I think Ambient, the one in California. So that's the genetic testing that they test you and then they send it into the lab and then send it to you. But Ascension in general or Borges in general, we don't have like a unit for genetic counseling, but the unit in itself, whether it's cancer care or wherever, they have branches that help them.
Thank you, Maria. And for the student who was curious about genetic counseling, we have had a few students who've been interested in that career path, and we have helped them navigate that process of getting into those grad programs. So please feel free to connect with your career advisor or your academic advisors. We'd be happy to help you with that.
We do have another question for any of the organizations. Can the volunteer work be done in the summer only?
Yes, it can be done just summer only. It can be done we can keep you on as a volunteer and do summer and then winter break and that type of thing. It does not necessarily have to end at the end of the summer. It can, but we can keep you on as a volunteer and just whenever you are around or school schedules or whatever changes, you're able to volunteer. So several different options as far as volunteering.
Thank you. Renee?
Yeah, ours would be similar to what Sharon mentioned. So very flexible. I mean, some people do choose to volunteer only in the summer because that's when they're more available, but we do also have volunteers that choose to volunteer once a week. We do also have, like I mentioned, events that sometimes need a little bit more volunteering, and you could always only volunteer on events if that's something you're interested in, or only for specific types of things when they happen. So as long as you've applied to be a volunteer, basically we just do your background check, and then as long as you're all set, then you would be a volunteer in our system indefinitely, unless you chose not to be anymore.
Thank you. And Rebecca, I know that it might be an it depends type of scenario, but for volunteering in the summer.
Yeah, like I said, I'm really not aware of the opportunities we have currently. So that's something you'd have to reach out to Josh about. But now that you're saying this, I'm like, I need to talk to someone. We need more volunteers.
We have students ready for you, so thank you.
I know, that's great.
And Jeff?
Yeah, I would say once you have your foot in the door, whether it's being a scribe, it opens up a lot of other opportunities. Like a scribe that I knew was going to be a PA, she was able to get an internship in the cardiovascular unit and get some really advanced experiences that way too. So any way you can get your foot in the door, I highly recommend to diversify your portfolio there.
Thank you, Jeff. Lisa?
I think we're good. I think all the questions were answered, and I do appreciate Mike taking and answering that question directly in the chat for that student. So thank you all very much. And thank you for our GVSU partners who joined us today from class advising. I did go ahead and put some links in the chat for the participants today to provide them with that GVSU direct contact of volunteers and shadowing, and just getting them familiar with what class has to offer and other partners across campus. So with that, Megan, and you could wrap it up.
I was just going to say thank you very much, students, for attending today. We hope that you find some opportunities. I think right now is a great time to be hired into healthcare, in a sense that there's a lot of opportunities, and volunteering is great, and also getting paid to work is great too. So if you are trying to pay for school, there's a lot of great things here for you. But please don't hesitate to reach out. I know a lot of students just feel a little uneasy about doing that, but please do so. The recruiters are looking for you. So I think a great connection could be made there. Employers, thank you very much for supporting our students and providing the opportunities available. We look forward to partnering with you more in the future too. Otherwise, you are all free to leave. Thank you very much for attending. And if you have questions, Lisa and I will stay on for a few minutes, but otherwise have a great day. Thank you.
Thanks, everyone.
Thank you. Thanks, Megan.
Thank you.
Thanks. And I was hoping to chat with you just for a minute before we get off, Megan.
Yeah, sure. Just hold on one moment.
Yeah.
And Megan, I forgot to mention, I hired my first intern from Grand Valley for HR. That was like 16, 17 years ago. She was an intern because she was a HR major. And then we hired her on after she graduated. And now I think